Good morning, everybody in the room and colleagues online this morning. And if this is your first time at an SPSP learning session, you're very welcome, and I'm glad you could join us this morning. As Eddie says, I lead the Acute Adult Programme within Healthcare Improvement Scotland, and I know many of you in the room through the work that we're all doing together. So as Jo said in her presentation, I just wanted to recap on the core components of the collaborative at the moment. So the focus on the essentials of safe care, of which all of our work is built on. And the two main areas of focus, which we hear a lot about this morning, around deteriorating patient and falls. And we have a really active learning system around this, and many of you will have been part of our network and our webinar series, and indeed come to events and share your work from the boards. So we're delighted that all of the territorial boards in Scotland are part of this collaborative, focusing on both deteriorating patient and falls, or one or the other. But today we're also delighted to be joined by colleagues from NHS Wales, NHS England, the Channel Islands and the Republic of Ireland online. So you're all very welcome today. So those of you that were at the first learning session, which was September 21, and we were in a bit of a different time at that, so virtual was the only option open to us all, so we were all online. We spoke about the quality improvement journey and how this can guide us on our improvement work, and this is still true today. And teams have gone from one end of this journey to the end, back again, to the middle, to the end, back again. And that's exactly how we described this at the beginning of the collaborative. And as we hear from teams within the boards later today in the breakout sessions, I think this will resonate with the work that they're doing and what people are going to leave today with a message of what can come next. So how did the collaborative look? So this was our plan, as you know, to run until August this year. And it's peppered with all different sorts of things from our steering group, which we have opportunities to share learning and guide us for the collaborative. We have an advisory group. You're all very good at giving us your data on a quarterly basis and a narrative update of the work that's in the board. But we were hearing, as Eddie alluded to, how challenging it's been for people. And I think it's a bit like this, isn't it? So we thought in September, when we launched the collaborative, great, let's go. We're all fired up, we'll go. But actually, in reality, some of us are up and down on that little surfboard that's there. So we've spent a lot of time coming out to visit you all, whether it be virtually or in person, and speaking to our steering and advisory group around how does it feel from a timing point of view. Lots of things have happened. I'm not going to go into them. You've lived this. So through those conversations, we've made a decision to extend the collaborative until March 24. And that seems the right thing to do. And people just said, can we have some more time? Now, we know this work won't go away at the end of the collaborative, but the opportunity to come together, and indeed planning to come together again in March next year for a bit of a celebration and for boards to share work is where we're going. So next, I just want to touch on what work has happened in relation to falls and deteriorating patient, and this work has been supported by all of you in the room and people who can't join us today. So if we touch on falls, so we all know the wicked problem of falls. Nobody can define it, so it's a very, very tricky thing, and it's lived with me through all of my career in the NHS, and we've still got this problem of what is a fall. So we decided to tackle it once for all. So we're delighted that we've got the support of SEND and the HP directors to really do this piece of work to establish what is a fall. And why is that important? Well, when we're all learning from each other, if we're counting it differently, if we think it's something different, if somebody thinks it's a feint, if somebody thinks it's a controlled fall, we're all looking at different things. So we've been carrying out a Delphi process, and that's now complete. So we're about to move to the post-Delphi questionnaire, and my plea to everybody in the room who has an interest in falls is if you can complete this questionnaire, because it'll help us get to that final definition, and then we'll take that work back through sending the HP directors for ratification. Not an easy piece of work, but delighted that so many people have been involved in this. We've been kind of overwhelmed with the amount of people who wanted to be involved. Another piece of work, and I'm delighted that David, our public partner's in the room today, and David challenged us with one of the advisory groups, and Eddie said, this is your question, Claire, I remember it, was how do patients and people know what the Scottish Patient Safety Programme is? Many of you will have boards in your wards which display your data, your safety crosses, how you're doing. How do patients and relatives know what that is? So David challenged us to say, what information can we actually give to people to say, we're a team that's taking part in this safety programme. This is what it means and this is what we're trying to do. So we're delighted that we worked with 5 boards to bring this together, and I see Laura sitting there as well in the room. Laura was a leading light in this, and we now have some really good pieces of information that's given to patients on admission, particularly around falls, to say we're taking part in the Scottish Patient Safety Programme and this is what this means. So I think that's a big move forward as well. Jo-Marie and the team have done a stellar job in the last month or couple of months updating the driver diagram, reviewing the evidence and speaking to colleagues about some of the change ideas and work, and that's in the delegate bag. And of course, we've got such an active falls network. There's a bit of competition going on between DETPAT and falls, but falls always wins, and they've got the main plenary room for the breakout today, so that means they've won. But the networks are really, really active, and on request they're coming together in person in June, so get to come into Delta House in Glasgow, which is great. So from a deteriorating patient point of view, it's as busy, to be fair. So teams have been focusing on reliable data collection, and we'll hear from NHS Lanarkshire in the breakout around their work in cardiac arrest and implementation of DATEX. Gregor and colleagues have been leading the work around structured response to deterioration, and many of the boards, I think it's now 7 boards that took part in the mapping a workshop that we held last month, I think, and we've got a couple of boards that we're doing it bespokely for in the next couple of weeks. And I think the nicest thing about that workshop, and I know Gregor was a wee bit nervous, Gregor, I don't mind saying this, he's like, will this work? Will this be the thing? Is that all of those teams have asked, can we come back together and share our learning? So we're arranging that for late summer. If you didn't know, the deteriorating patient sign guideline has been under review, and we have been contributing to that as part of a team. And once that is published, I think it's out for the final consultation, Eddie, Gregor, I think it is, yeah. We will review the current deteriorating patient driver diagram to make sure the evidence is up to date. But of course, it's not just a focus on deteriorating patient and falls. We know that there are many other enablers that are required to do this. And when we ask boards what they're focusing on, they tell us leadership, a system for learning, improving reliable data collection and interpretation. So it's not just meaningful activity for falls, but all these things are very, very important. So what's the next steps? So I remember coming to the first SPSP learning session. At that point, we used to go to the exhibition centre for 3 days, and we did a bit of singing and a bit of dancing and things. So I have got some music in a minute, but I'm not going to sing or dance. But my ask to you is to make connections. And if you're online and you see people and you think, actually, I think they're doing some work, get their email them, phone them up. Yeah, we've still got phones, haven't we? I don't think anybody uses their phone anymore because we've got Teams, but make that connection. We're bringing together the networks in June, and we're going to review the sepsis driver diagram and change package, and we've delayed that because of the sign guideline update. So we know that the AMROC paper around sepsis requires this work to be updated, but we'll do that. And of course, like always, we'll bring that together in a co-design process through the expert reference groups. And please, I hope we get a definition of a fall. That can be my legacy. I think that can be my legacy if that happens. you.